damage there. Myocardial ischemia, stroke, and these two are due to blood clots that can form around the aneurysm site as blood stagnates and doesn't flow as good. So we have to be, as a nurse, we have to know the signs and symptoms of those. Paraplegia and acute pain related to pressure from the expanding aneurysm. Those were some problems as well. And also, we have risk for infection related to surgery. And this is if the patient opts to have surgery or the aneurysm is large enough to have surgery. We'll have that problem. Knowledge deficit related to new diagnosis of AAA. This is going to be very important to the nurse. We're going to have to make sure that the patient is aware of the disease process and complications and things to do to further complicate the situation. Anxiety related to possible complications of disease. Anxiety will contribute to hypertension, and this should be one of the main components to control, because anxiety will cause your blood pressure to go up, and this in turn puts pressure on the aneurysm, which will cause it to even get bigger and bigger, thus having to have further treatments. Ileus is another complication. Ileuses are formed with the growing aneurysm when it pushes on the intestinal walls. This could cause a major problem for the patient. Lower extremity ischemia. This happens when the blood is cut off from the lower extremities due to the aneurysm, and you will see changes in skin color. There has been reported cases of blue toes where it would be so bad that their toes will turn blue. So this is something we have to monitor and help the patient to understand. All right, back to the management of AAA. If it's newly diagnosed, say the person comes to the ER and doesn't know what's wrong with them, has never been diagnosed with AAA, and he's complaining of abdominal pain, back pain, and he says he feels this pulsating mass right in his epigastric area. This should alarm the nurse to start thinking, well, possible AAA. And that will in turn lead you to start getting a good history. Do you have a family history of AAA? Have you had these symptoms before? Just ask the question, basic questions about paralysis, or do your feet get numb, just questions like that. So from then, you're going to prepare the patient for some diagnostic studies. We talked about those earlier. I think we had ultrasound was on that list, and we're going to explain to the patient that the ultrasound is going to show us if you have an abdominal aneurysm. And that is something that is usually in the screening process, especially for males over 60 years old. They're going to have that right away, and that's going to pretty much tell the doctor, give him some clues as to what's in there. We're going to monitor the vital signs. Something we're going to be well aware of is the blood pressure. Is it normal? Is it high? Is it too low? If it's too high, we're going to have to see about giving some medications to bring that blood pressure down. Systolic blood pressure should run 105 to 110. If it's any higher than that, that's putting the patient at risk for rupture. If it's real low, the systolic's below 90, you may want to get prepared to treat shock or blood loss. So just take good vital signs if they're in the ER. Monitor vital signs every 15 minutes. You're going to be doing some lab tests. Again, there's numerous tests that will be ordered. As soon as you have results, look at these and relay them to the doctor as soon as possible. Again, keep the doctor informed if any sudden drop of blood pressure or rise in blood pressure symptoms.